Hello, welcome to week one, and this session is going to talk about open dental. And we're going to be talking about open dental for the next 4 weeks. So open dental is extremely important. I'm going to point out some of the very basic things that you need to know about open dental and what it really is about. For many of you, you have no experience in the dental field, and if you do, I apologize, and maybe you can even skip this. My first advice for anybody coming on that has no dental experience is to download Open Dental at opendental.com, I believe it is, and download the software. And you can use it on your laptop or your desktop, and you can put in about 25 patients, I believe, and you can practice with that. And that'll teach you a lot about how dental software works. This dental software in particular was designed by a dentist, and it has the flow in which is integral to the way dentists actually think and put things together. So there's other dental softwares that we can talk about, and we will talk about at a later date. One is called EagleSoft. Patterson, the dental distributor, gives you EagleSoft. There's also Dentrix is a very popular one. And there's ones that Kodak and things like that are very popular as well. So we use Open Dental, and Open Dental begins with the interface of the calendar. So it works through the calendar. So just have that as the home base. Just like any other programs, you have the upper part. Up here you have the file, the setup list, and all these things up above. That carries from window to window. And here you have special tabs that relate to the patient. So over here relates to the patient, and these relate to just generally every window. So that's just a basic outline here. We'll get to this part of the calendar window later, but really what's important is just understanding how do you get a patient in. You select patient, and a window is going to come up. And now you can find a patient in any which way you want. So if you want to look up a W patient, it'll start finding the W patients, and then you keep going through until you select a patient that would come up. So let's grab this patient here. We'll say OK. And now what's really key and something you have to pay attention to as this patient is listed up here to identify that now everything you use along this side, that this patient is the one that the chart and the treatment plans and the financials and their whole chart is now going to be presented. So let's look at this. We're going to go to the chart page because that's the first really important window outside of just this layout of the home page. So let's take a look at that.